Hi, I'm Charlotte Moser, co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about rotavirus. Now, the rotavirus vaccine offers us a good example of how well the safety systems in the United States work, because the very first rotavirus vaccine put that system to the test. So what happened? The first rotavirus vaccine, called RotaShield, became available in the United States in 1998. And shortly thereafter, reports of intestinal blockages started coming into the Vaccine Adverse Events Reporting System, more commonly known as VAERS. Now, VAERS gets a lot of attention, so before we talk about what happened with RotaShield, I wanted to briefly touch on what VAERS does and doesn't do. If you think about a filter, you want the top of the filter to be wide so it catches as much as possible as quickly as possible. That's VAERS. Anybody can submit reports to VAERS, and they don't need any proof that the event was caused by a vaccine. As reports are submitted, public health investigators review them, while also watching for any concerning trends. If they see something concerning, then they need to look at other parts of the safety system. Because remember, VAERS is the top of the filter. It's gathering anything and everything that just might be related to receipt of a vaccine. So to get to the point of understanding whether an event actually is caused by a vaccine, we need to get to the bottom part of the filter. And that's where another system, called the Vaccine Safety Data Link, or VSD, comes into play. So if we go back to RotaShield, VAERS was getting these reports about intestinal blockages. And this condition is called intussusception. And it occurs when part of the intestine folds into another part of the intestine, and it causes a blockage. This condition is very painful, and it is considered a medical emergency that often requires surgery to fix. So as public health investigators identified this concerning trend in the reports, they did two things. First, they temporarily stopped use of that rotavirus vaccine. And then second, in order to figure out if the blockages were actually being caused by receipt of the vaccine, they turned to the VSD system. Now, this part of the safety system includes several health systems from different parts of the country, which allows scientists to do controlled studies using patient health records. In this case, they needed to look at the records of babies who did or didn't get RotaShield and compare the rates of this intestinal blockage. And what they found was that yes, babies who got the vaccine were more likely to have experienced the intestinal blockage. The rate was about one baby having an intestinal blockage per every 10,000 to 30,000 babies who were getting vaccinated. As a result, the vaccine was removed from the U.S. market, and another rotavirus vaccine didn't become available in the United States until 2006. Now, there's another important thing that we can learn from the RotaShield experience. Remember, that rate of intestinal blockages from the vaccine was one baby per every 10,000 to 30,000 babies who were vaccinated. This demonstrates how sensitive these systems are. So when people worry that vaccines are causing chronic conditions that are much more common, and we simply just haven't found them yet, you can quickly realize the disconnect. If we think about autism as an example, the last measure for that was a diagnosis rate of 1 in every 31 children, which would be about 323 children per every 10,000 children. So it quickly becomes clear that our vaccine safety systems could detect such a frequent occurrence if there was any there. So let's turn our attention to what we'll be discussing today. As in other episodes of VEC Vaccine Notes, we'll talk about the disease caused by rotavirus, the vaccines available to prevent it, common questions we get here at the Vaccine Education Center, and we'll finish up with a look at the relative risks and benefits of rotavirus disease and vaccination. So let's get to it. Rotavirus is a virus that infects the lining of the intestines. Many parents don't recognize the name of this infection, but they do tend to recognize the symptoms. Children with rotavirus tend to have a high fever, They have repeated forceful vomiting and profuse diarrhea. These symptoms last for about a week. And babies with rotavirus simply can't keep anything down during that time, which makes it really difficult for them to stay hydrated. Babies who end up in the hospital from rotavirus usually end up in the hospital because of severe dehydration. So much so that sometimes the healthcare team even has trouble getting an IV into their vein to rehydrate them. Virtually all children have been infected with rotavirus by the time they reach 5 years of age, but most tend to have their first rotavirus infection between 6 and 24 months of age. As a result, before there was a rotavirus vaccine, each year in the United States, about 2.7 million children had rotavirus infections. About 500,000 of those children had to see a doctor, and about 55,000 to 70,000 ended up in the hospital. Sadly, each year in the United States, about 20 to 60 children died from their rotavirus infections. And in countries where medical facilities were not always accessible, those numbers were very much higher. It's estimated that before we had a vaccine, about 500,000 babies every year died from rotavirus. Now let's turn our attention to the rotavirus vaccine. There are currently 2 rotavirus vaccines available in the United States, Rotatec and Rotarix. Both of these are what we call live weakened vaccines, and both are given as droplets in the mouth. At this time, the rotavirus vaccine is the only routinely recommended vaccine given to babies that is given orally. An older version of the polio vaccine was given by mouth as well, but we switched to the shot in the 1990s. To find out more about the reasoning behind that change, check out the VEC Vaccine Notes episode on polio, or take a look at the polio page on our website at vaccine.chop.edu. So let's talk about Rotatec first. I'm pleased to share that the virus strains used in the Rotatec vaccine were created right here at the Children's Hospital of Philadelphia. The Vaccine Education Center's director, Dr. Paul Offit, along with Drs. Fred Clark and Stanley Plotkin, developed the virus strains for this vaccine. So how did they do that? Rotaviruses infect different animals, including cows. So Drs. Offit, Clark, and Plotkin took a rotavirus strain that infected a cow, and they grew it in the lab in containers that also contained a rotavirus strain that infects people. As the 2 viruses grew, they shared their genetic material. And so the team here at CHOP then studied the mixed viruses and isolated those that contained all of their genes from the cow virus except for one, which would be from the human virus. Now, they knew which parts of the human virus could generate protective immunity due to previous work on rotaviruses, and that's how they were able to create the 5 different viruses that each contained one important human gene. However, because these strains were mostly made from a cow rotavirus, babies who were vaccinated would not get sick with rotavirus, but they would develop immunity against those important parts of the human virus. Now, I started working in Dr. Offit's research lab in the early 1990s, after these vaccine strains were already made. At that time, Merck, the manufacturer of Rotatec, was already doing early testing on these strains as a potential vaccine. But if you remember, I mentioned that another rotavirus vaccine wasn't available until 2006 after RotaShield went off the market. That vaccine that became available in 2006 was Rotatec. So if you do the math, it took almost 15 years between when the strains were made and when all of the clinical trials related to the testing of the Rotatec vaccine were completed to determine that both the vaccine was safe and that it worked to protect babies against rotavirus. This is an example that speaks to the fact that science takes a long time. Now, the second rotavirus vaccine is called Rotarix. It became available in 2008. And that one is made from a rotavirus that infects people, but it's been weakened by growing it in the lab in non-human cells. This is called cell culture adaptation. And after growing the virus over and over in non-human cells, it becomes better at infecting those cells than it does at infecting human cells. So when we take the vaccine and put it back into people, the virus has been weakened so that it doesn't grow as well as it once did in people, but it still grows well enough to cause an immune response without causing illness. Now, there are a couple of other notes about these two vaccines. First, they require different numbers of doses. Rotavirus is given in 3 doses at 2 months, 4 months, and 6 months of age, whereas Rotavirus only requires 2 doses given at 2 and 4 months of age. Second, in both cases, the first dose must be given before a child reaches 15 weeks of age, and all doses need to be completed by 8 months of age. So if a baby's vaccines are delayed, they could miss the opportunity for protection from rotavirus through vaccination. In terms of side effects, there are 2 aspects of these vaccines that we should discuss. First, we already talked a little bit about that rare intestinal blockage that followed the use of Rotashield. Because of that, the clinical trials for the 2 current rotavirus vaccines had to be large enough to check for that same condition. And remember, it didn't happen very often. So to make sure they had enough babies in the clinical trials, the 2 vaccines combined tested the vaccine in more than 130,000 babies. And even after the clinical trials were done and the vaccines became available, researchers continued to monitor for intussusception. Even though these intestinal blockages were still found on occasion after receipt of the new vaccines, these vaccines remain on the market. So why is that? First, after the Rotashield incident, studies of natural rotavirus infection were completed and found that rotavirus itself also causes these intestinal blockages on occasion. Second, the newer rotavirus vaccines, the ones we use now, caused the blockages much less frequently than Rotashield did. It was more on the order of 1 baby with an intestinal blockage in every 100,000 vaccinated babies. These rates of the intestinal blockage with the newer vaccines were similar to the background rates before the newer vaccines became available. So that meant that the risk from vaccination was not greater than the risk from infection. The other aspect of rotavirus vaccine side effects to be aware of is that these vaccines were evaluated for symptoms that would be likely with a rotavirus infection. Remember, these vaccines were made with live weakened viruses. So the scientists wanted to make sure that babies weren't developing the symptoms that would be associated with a rotavirus infection, like vomiting, diarrhea, fever, irritability, or even poor feeding. And what they found was that the rates of side effects were no different in babies who got the vaccine compared with those in the placebo groups. So even though these vaccines deliver live weakened viruses, they're not causing babies to get rotavirus. Now, we don't get a lot of questions about rotavirus in the vaccine, but we do get a few, so let's talk about those now. Sometimes people ask about that period between 1999 and 2006 and why we didn't have a vaccine, and then it was put back on the schedule. And as we discussed earlier, the vaccine that was removed in the late 90s was the Rotashield vaccine, and it was removed because of that issue with the intestinal blockages. The one that became available in 2006 was a different vaccine, Rotavirus, which had a much lower risk of the intestinal blockages. Basically, the risk is no higher than if a baby didn't get vaccinated. Now, another thing that we didn't talk about earlier that may be of interest here is that Rotashield is still available in some other countries. And you might wonder why anybody's using that vaccine. And the reality is that even with the increased risk of 1 in 10,000 to 1 in 30,000 cases of intestinal blockages, the benefits of that vaccine still outweigh the risks in certain places. Each year, remember, before there was a rotavirus vaccine, around the world about 500,000 babies died from rotavirus. That's about 1,400 babies every day. Some estimates suggested that it could be up to 2,000 babies every day that died from rotavirus. So in those parts of the world, particularly where medical care was limited and many babies died, the ability to save them changed the risk-benefit calculation. Another question we get is about the specific timing of the rotavirus vaccine. And this has to do with two things: concerns around the intestinal blockages that we've been talking about, and the susceptibility of babies to rotavirus. The rotavirus vaccine is recommended to be started before a baby reaches 4 months of age because the risk of intestinal blockages is greatest between 5 and 9 months of age. And that's from any cause. It's not just from rotavirus. Babies just are more susceptible to this during that earlier time period. The recommendation on the other end related to completing the vaccination by 8 months of age has to do with ensuring that babies are protected with their own immunity before maternal antibodies decrease to a point that they're no longer offering protection, particularly since babies are most at risk from rotavirus in that first 2 years of life. Now, sometimes people wonder if the rotavirus vaccine can cause babies to have bloody bowel movements. And the answer to this is no. Babies who have diarrhea from either natural infection or vaccination do not experience bloody bowel movements. Blood can come from some other types of infections of the intestine like Shigella or Salmonella, or from health conditions that are related to the digestive tract. If your baby has blood in their bowel movements, talk with their healthcare provider so that they can help you sort what might be causing it or order some additional testing. Sometimes people wonder if babies really need that third dose of Rotatec since Rotarix only needs 2 doses. The short answer is yes, we'd recommend that. And the reason is because the studies of Rotatec showed that babies who had only 2 doses had lowered their hospitalization and emergency room visits by 84%. But when babies had 3 doses, those interactions with the medical system were decreased by 95%. So that third dose really did make a difference in better protecting infants from needing medical care from a rotavirus infection. Okay, let's finish up with a look at the relative risks and benefits. Today we talked about the fact that before there was a rotavirus vaccine, about 500,000 babies around the world died each year from rotavirus. In the United States, those numbers were much lower in comparison, only about 20 to 60 babies. But those are deaths that now are largely preventable through vaccination. Likewise, in the United States, hospitalizations have decreased by about 80%, down from about 55 to 70,000 hospitalizations to only between 11 and 14,000 hospitalizations from rotavirus infections each year. We also talked about the fact that babies are sick for about a week with fever, vomiting, and diarrhea, and that 2 health concerns are more severe: dehydration and a rare intestinal blockage. The vaccines, on the other hand, don't cause side effects similar to those with disease, with the exception of a very small number of intestinal blockages. But even with that, the rate is no greater than background rates, meaning a vaccinated baby is no more likely to experience that intestinal blockage than an infant who's not vaccinated. We also discussed that this vaccine is given by mouth, but that there is an age range when babies can start and finish this vaccine. With all of this in mind, when our team evaluated the relative risks and benefits of this vaccine, we felt that the benefits of the vaccine far outweighed the risks. And we hope that once you've reviewed this information, you'll feel that way too. Thanks for listening today.